So hello students, today we are going to discuss is Vazirani Akinosi closed mouth mandibular block. So who described that? It was Dr. Joseph Akinosi who described the closed mouth approach to the mandibular anesthesia. So what are the other name of this technique? Other name is Akinosi technique, closed mouth mandibular nerve block, or it is known as tuberosity technique. What are the three names? Other names are, number one is the Akinosi technique, second is the closed mouth mandibular nerve block technique, and third is the tuberosity technique. Now, what are the nerves that are anesthetized in this technique? The nerves that are anesthetized in this technique are the inferior alveolar nerve, incisive nerve, mental, lingual, and mylohyoid nerve. And what are the areas that are anesthetized? Number one, the mandibular teeth to the midline, body of the mandible and inferior portion of the ramus, buccal mucoperiosteum and mucous membrane anterior to the mental foramen, anterior 2/3 of the tongue and the floor of the oral cavity. Now, what are the anatomical landmarks? The landmarks for this technique, first landmark is the occlusal plane of the occluding teeth, mucogingival junction of the maxillary molar tooth, and anterior border of the ramus of the mandible. So the three anatomical landmarks, they are, number one, the occlusal plane, mucogingival junction of the maxillary molar, and anterior border of the ramus of the mandible. Now, what is the area of needle and insertion? So you have to hold the syringe at the height of mucogingival junction above the maxillary third molar. So it is indicated in cases where there is limited mouth opening. So that is important for your entrance exam. When either one have to perform multiple procedure on the mandibular teeth, and in procedures or when there is inability to visualize the landmarks for inferior alveolar nerve block. Example, in case when there is presence of large tongue, so we can use this technique. Now, what are the contraindication? It is contraindicated in the patient who may bite their lips or their tongue, such as young children or physically or mentally handicapped adults. Now, what are the advantages of this technique? The advantages is it is relatively atraumatic. The patient need not to open the mouth. So there are fewer post-operative complication, that is the trismus. The disadvantage, it is difficult to visualize the path of needle and depth of insertion. So there is no bony contact. And it could be potentially traumatic if the needle is close to the periosteum. Now let us discuss the technique. The patient is seated comfortably in the dental chair. The patient is instructed to occlude the teeth. The syringe that is aligned parallel to the occlusal plane. The syringe is attached parallel to the occlusal and sagittal plane. It is positioned at the level of the mucogingival junction of the maxillary molars. So this is where somewhat here it could be the position. So the needle, it penetrates the mucosa just medial to the ramus. So remember, care should be taken that the needle is near the medial surface of the ramus, allowing the needle to be advanced far medially is likely to result in the deposition of the solution on the medial surface of the pterygomandibular space and sphenomandibular ligament. That would lead to inadequate anesthesia. So where should be the tip? So the tip, remember the tip position, and how much solution we have to deposit is 1.5 to 1.8 mm of anesthetic solution that could be delivered in approx 60 seconds. So remember, the motor nerve paralysis, it develops as quickly as more than the sensory anesthesia. The patient with the trismus begins to increase ability to open the jaw after the deposition of anesthetic solution. So what are the sign and symptom? You will see the tingling and the numbness. The lower lip, there will be anesthesia of the mental nerve, that is the terminal branch of the inferior alveolar nerve. The tongue, there will be anesthesia of the lingual nerve, a branch of posterior division of the mandibular nerve. And the objective sign that you could see is there is no pain is felt during the dental therapy. So the precautions that you have to take is do not over insert the needle. So the failure in the anesthetic technique may occur due to the flaring of the ramus. The complication that could be seen, it could be an hematoma, trismus, transient facial nerve palsy. So this was all about this block.